They know it causes obesity, diabetes, even early dementia. But they're still telling your teen to eat this for breakfast. Why? Because the food industry pays them to. Let me show you the science they're ignoring and the truth your doctor won't say out loud. Hey everyone, my name is Marc Bates. I'm a metabolic health coach, and this is part of my question and answer series. Why teens are being metabolically poisoned and no one will admit it. Okay? So let's get to the question. You're describing a biochemical cascade that sounds almost inevitable once it starts. But here's what puzzles me. Public health officials are still recommending these high-carb, low-fat approaches for teens. Are they genuinely unaware of this mitochondrial research, or is there something else keeping these recommendations locked in place? Well, now you're asking the right question, and it's one that cuts to the heart of the metabolic health crisis. The persistence of high-carb, low-fat dietary guidelines isn't just a matter of outdated science. It's a tangled web of institutional inertia, industry influence, and scientific myopia. Here's what is really going on. First, they're not unaware, but they're incentivized to ignore. Many public health officials and professional dietetic organizations are aware of mitochondrial dysfunction, insulin resistance, and the rise in metabolic disease, but their training is 20 to 30 years behind the science. They rely on evidence hierarchies that favor large, decades-old epidemiological studies over modern biochemistry, metabolomics, and clinical practice. They're locked into consensus science, which values policy uniformity over accuracy. The newer research on mitochondrial redox state, linoleic acid's role in cardiolipin instability, and the protective effects of ketones is mostly ignored because it doesn't fit the USDA pyramid model or food industry product lines. Okay? 2. As I like to say, the firefighters are funded by the arsonists. Okay? So many public health agencies and professional nutrition groups receive their funding or get great influence put on them from cereal and grain alliances, dairy boards, especially low-fat milk, plant-based meat and dairy lobbyists, and seed oil conglomerates. For example, ADM, Cargill, Unilever. For example, both the Academy of Nutrition Dietetics and the American Heart Association have accepted sponsorship from General Mills, PepsiCo, and Nestle. Talk about a conflict of interest. But this influence is not always overt, but it steers research funding towards safe questions, i.e., for example, whole grains versus refined grains, position statements away from vilifying seed oils or carbohydrates, and curricula in nutrition schools toward promoting plant-based dogma all have an influence. Okay? The guidelines are a political document, not a scientific one. The USDA dietary guidelines are reviewed every 5 years by a committee, but they are not allowed to question past recommendations like low fat. Any new science must pass through systematic reviews that exclude observational studies newer than a certain date and disregard non-RCT metabolic ward data. Mitochondrial science, low-carb interventions, and carnivore trials don't fit that model. In her book, The Big Fat Surprise, Nina Teicholz documents how the 2015 Dietary Guidelines Advisory Committee ignored new evidence on saturated fat and blood lipids simply because it contradicted the existing narrative. Okay? Changing course means admitting they were wrong. Oh, this is the biggest one. Public health institutions are deeply risk adverse. Admitting that the last 50 years of dietary advice have been wrong, harmful, and a primary contributor to the obesity, diabetes, and autoimmune epidemics would open the floodgates to liability, class action lawsuits, and a total collapse of public trust. So instead, they quietly shift from low fat to healthy fats without defining that, push plant-based diets as a moral and ecological smokescreen, and keep the food industry happy by recommending whole grains, fruit juice, and soys. Okay? Remember, this isn't about nutrition. anymore. It's ideological. The dominant narrative isn't driven by biology, but by environmentalism. Meat is bad for the planet. No, it's not. Okay. Animal ethics. Plants are more virtuous. I don't eat anything with a face. Well, that's your problem. Equity agendas. Low income diets should be plant based and subsidized. Okay. But meat is actually probably better and probably lower cost if we would also subsidize it. Even if you show that meat reverses diabetes, improves fertility, restores mitochondrial function, many institutions will reject it because it doesn't align with their worldview. This is why in the book The Great Plant-Based Con by Jane Buxton and the Ancestral Diet Revolution are so critical. They expose the cultural, ideological scaffolding propping up modern dietary dogma. Okay? Bottom line, they're not unaware. They're entrenched, financially, politically, and ideologically. But this is exactly why the metabolic health community, coaches, physicians like Dr. Tro Callaghan and Dr. Chris Palmer, and scientists like Dr. Ben Bickman have to go around the system, not through it. All right? So, thanks for watching. If you have any comments or questions, please put them in the appropriate section. This is a community. I'm here to try to answer your questions, make sure you're getting what you want. Let me know if there's something you want me to cover, and we'll try to add it to the schedule as soon as possible. And as always, if you haven't done so, please like, share, subscribe to our channel. It helps the channel a great deal, and you'll help a lot of other people. Thank you so much.